My name is Dr. Kibachio. I'm from Kenya, the National Public Health Institute in Kenya, which I'll explain in a minute. And I also head the Non-Communicable Diseases Division within the Ministry of Health. Oh, a National Public Health Institute is one of the most important public health platforms you can think of, because, you know, diseases know no boundaries, and core public health functions need to be coordinated. Otherwise, there will be anarchy in the field of public health. In Kenya, previously, most of the public health functions were scattered across different departments, and so for the bureaucracy and the different departmental heads, sometimes there was undue delay, especially for public health functions which don't need a delay, like an outbreak investigation or a report of a disease from one corner of the country. So for us, one of the directorates within the ministry is called the Directorate of Preventive and Promotive Health Services. And this is where most of the core functions are domicile, surveillance, disease outbreak investigation, capacity building, the field epidemiology and lab training program is held here, the lab function, and all the other public health functions, HIV programs, TB, malaria, most of them held under this directorate. And so there was a strategic decision to make this directorate the National Public Health Institute, because it would be doing the functions that a National Public Health Institute does. Now, within Kenya, there is also another National Public Health Institute recognized by IANPHI, and that is the Kenya Medical Research Institute, which works very closely with the ministry and more so with this directorate. And so for us, this is a step in the right direction, remembering that in the year 2010, the ministry and the entire government also was devolved. So we have counties, and like how we were in the past, where the Ministry of Health had sole mandate and jurisdiction over the whole country. Now we have county governments that have little mandates across the country, and that even underlines the importance of the National Public Health Institute, because it's able to bring together public health functions from across the country in a divided state. So to avoid the red tape while going from county to county, then it is in order to have a National Public Health Institute that has undivided attention and jurisdiction across the county. So I would say that for us, a National Public Health Institute is a key pillar in the delivery of health services in our ministry. To begin with, the grant that was given to begin the thought and to establish this National Public Health Institute came from IANPHI. And I would say more so not even the funds, but the technical support to understand the concept of National Public Health Institute. When we started, the minister, the heads of directorate, the DMS, that's the Director of Medical Services. When you speak of the National Public Health Institute, what comes to mind is a building or a school. But this is a concept, is more of a think tank that brings together core public health functions and to coordinate. And so now we are starting to see, thanks to IANPHI's support and their funding, we are starting to see people resonating to this idea that different departments and different individuals can work together for the common good of public health. And so IANPHI has really come through, and that's one. Two, the capacity building. Some of us have been trained. For example, here we are in the Leadership Academy, which is another phenomenon training, which I know me and my colleague will really benefit from. And I want to say at this point that you're building capacity in the young leaders of Africa in public health. In the next 10, 20 years, this training will really make a difference, because public health is not so much about the knowledge of public health, but of leading people, of bringing together resources in terms of technical experts, because public health experts, each of them are independent and they want to operate that way. But with leadership in public health, you're able to bring this for synergies. So we are grateful for this training. Also, with the funding from IANPHI, we were able to do several trainings across the country. We trained on Ebola. This funding came at the same time when Ebola was running wild in Africa. And so we trained Sentinel Public Health staff and surveillance officers across the country for anticipating at the airport. We really tried to look, we didn't have enough money, but we tried to train as much as we could the people at the port of entries and the ones who would be in the front line of this war. Also, at the same time, we had a training that was conducted together with PATH. One of the things I would appreciate about the grant from IANPHI is that it has brought together partners. It has pooled partners who have mind in public health. And so with PATH, which is a leader in innovation, we were able to train key Ministry of Health leaders on advocacy, public health policy advocacy. And we're already seeing a difference in this because people are able to follow through on some issues which they have been having problems with, and more so now that counties are here. For example, if you want to sensitize a particular county, these are totally different government, and you need skills to be able to approach them and to follow that through. And so this training was very key. Thank you to IANPHI. And also we have trained on epidemiology and data management, basic data management. In Kenya, the biggest challenge we had is we have loads and loads of data that is collected routinely, but it's not analyzed for public health utility. And so data that is not analyzed is useless, basically. And surveillance data also was just being collected for the purposes of, it has to be collected. And now we are having surveillance officers using it for action, making surveillance what it's supposed to be, information for action. Now, finally, being head at non-communicable diseases, I had to make sure that something sneaks in here for non-communicable diseases. And it is in order because non-communicable diseases are becoming a big challenge for developing governments like ours. And if unchecked, they actually would cripple the economy. So we decided to put a little of this IANPHI funds to finalize this strategy for non-communicable diseases. Prior to that, efforts on non-communicable diseases were scattered. So we put all these into a strategy which will be launched this quarter, later this quarter. And it's amazing how this little grant has been able to do much. And I guess thanks to IANPHI, we can say we appreciate, yeah. Sure.